My name is Sarah Lowe, and I'm a family medicine physician at CHRISTUS Trinity Clinic. I grew up in Jacksonville, Texas, which is a pretty small town in East Texas, and it was a lot of fun growing up there. A small community, so you just know everybody. And we used to play this game growing up: how many people you run into at Walmart that you know. And both my parents were educators in Jacksonville, so we really did know everybody and couldn't get away with anything. Probably the biggest influence on my life is my parents. Like I said, my dad is a minister, and so I grew up in that kind of very supportive, loving atmosphere. And then he was a high school math teacher. My mom taught junior high math for a long time, and then she taught junior college math. So we were always learning, always encouraged to learn and be inquisitive and ask questions, but at the same time, encouraged me very intimately involved in people's lives. So as a pastor, we spent a lot of time in the hospital whenever I was young, checking on church members who had surgery or who were sick. Growing up, I really loved science, and science was very intriguing, biology in particular. Loved learning how things worked and the way things worked. And then too, I love to read, and I still like to read a lot, and so mysteries were one of my favorites. And medicine was kind of a culmination of science and mystery and kind of figuring out, the root cause, like what's really going on here. And you pick up clues along the way in conversations with patients and put all those clues together to figure out what's going on. And so it was a way for me to combine that with my love of learning and reading to really take care of people. So I think it just kind of brought together a lot of my passions, so people and learning and educating, because I get to talk to my patients about what's going on with them and how to get better and how to prevent things. I really love getting to know people and families because you come in and you see mom and you get to ask about the baby and you get to ask about her parents and grandparents and how everybody's doing. You just kind of know about the whole family, and I think that helps you take better care of people. And the reason I went into family medicine in particular is because I really do feel like I get to be a part of their family. Watch people grow up, watch people age. You go through the hard times with them too, but you also get to really celebrate when things go well. I have a lot of educators in my family. Both of my parents, my brother's an educator, aunts and uncles, all educators. And so I really feel like education in healthcare is important. So talking to people about what's going on with them, why maybe they developed this disease or this problem that they have, how to prevent it. But really, I think if people understand what's going on, then they can better take care of themselves.